I'm going to go microphoneless as well, if that's okay with you. But it's good to get to be here. And how many of you are care providers? Do we have any physicians, care providers? Okay, we got a few in the audience. So, full disclosure, I'm not. I'm a scientist. So my degree is biochemistry and pharmacology and pharmacy students. But I teach at a Christian university, and faith is something I'm very passionate about. And helping our students connect what they do with their faith and who they are is really, really important in an age where secularism has kind of tried to... I want to bring those two back together. And so this course has given me an opportunity to help our students bring that back together. So just as a quick background, most of you don't know Lipscomb. So this is Lipscomb. There's David Lipscomb right there. It's a university associated with Church of Christ, founded in 1891 as Nashville Bible School, and over time has developed into a school of 4,500 students, 78 majors, 25 master's degrees, and 3 doctorates over its 125 years. It's 125. And our mission is to integrate Christian faith and practice with academic excellence. And really this mission is carried out, it says, not only in the classroom, but also by involvement in numerous services for the church and our community. And I think that's carried out in many ways. And as part of the mission over the last number of years, health sciences has become a growing part of Lipscomb University. It wasn't always a part of it, but it's become a growing part of it. And so we have today a building that is much older than our College of Pharmacy. It was actually built in the 50s. It was renovated a few years ago and is now the home of Lipscomb University. College of Pharmacy opened in 2008, so we've gone through and graduated several classes. But part of the core of our curriculum for these students is not only to meet all of the accreditation standards, but also provide some of our faith and our faith perspective to our students as well. So our students go through all the courses they would get at any other college of pharmacy, and then we add something to that. And I think what we add, I think, is really interesting. So the course actually was originally developed to be 3 separate course years, one for the P1, or second years, and one for the P3s. And so it would be 3 separate curricula. And we found it was going to be quite a challenge to manage the course the way it was designed. And so we actually redesigned the course in about the 3rd year of the curriculum. And it now has a rotating curriculum where students in their 1st, 2nd, and 3rd years are all in one course together. In Stowe Hall, one of our buildings next door to the Burton building, has this nice auditorium where all of our students can meet, as well as our faculty. It's a large enough space for that. And we have about 5 meetings per semester, so it's an hour of a large group session, followed by a 1-hour small group breakout, where the students will go from this huge group of 120 some odd students to 10 students and 1 faculty. Down and process some of the things that they've covered and talked about. In terms of content, we cover a number of different areas. So these are kind of the 3 broad areas that we cover over that 3-year curriculum: values, beliefs, and worldviews. We talk about what is a worldview, what does it matter, how does postmodernism versus essentialism versus a biblical worldview versus other worldviews, what does it look like to make decisions out of that worldview? We present those ideas and concepts. We talk about how do our beliefs actually connect with action. That our students don't get up one day and say, well, I know that this violates my conscience, since this medication, but I'm going to do it anyway because they say I have to if I want to have a doctor. That decision-making, we're trying to bring back, no, that your faith has to be a part of your decision-making process. And if you just divorce yourself from it and say, well, I'm just going to do this because it's just a job. What does that mean about who you are and how you're defining yourself and the way people see you? And also during that year, it's a very interesting year, we bring in different faith perspectives. And so we have representatives from Jehovah's Witnesses, Muslim faith, Jewish faith, and other faiths that come in and say, here are our specific healthcare needs or our perspectives. We want you to be aware of them. We want you to understand why we decide, for example, the Jehovah's Witness may say, well, we're not in favor of a blood transfusion, and here's our logic. Some of us are okay with maybe this, and some of us are okay with that, but we want you to be aware of that. And so we allow them to present those things, allow the students to engage in discussion with them. We also have a year on compassionate care, and I'll talk more about that in a minute, but the big picture is we are followers of Christ, and we think that Christ showed the greatest example of compassionate care that can be given. And so how do we model that and emulate that for our students so they can carry that into the practice? And then this year, actually, the topic is ethics and pain and suffering, and we talk about a lot of things. From a biblical perspective, we talk about the story of Job, the greatest story of suffering that we have recorded in biblical history, and what he went through and what he learned from it, and what we can learn from that story about who God is, about how he views this world, about how he views suffering. But we also do a lot of other things. So, for example, we bring in a funeral home director to talk about grief. Talk through the students and provide stories and examples of what does it mean to go through grieving. Our director of counseling services at Lipscomb University. Suicide. Identify and recognize people who are at risk for that. Had one on conflict management. Our president of our university, President Lowry, is a lawyer, and conflict management is something that's his area of expertise. And so he came to our students about that. And actually, just yesterday, about 24 hours ago, we ended a session where I sat with 3 people next to me in front of the students, and they were dressed, well-dressed people. They looked like normal people, and they each told their story of how, as pharmacists, they'd fallen into drug addiction. Really made an impression on the students to say, look, these are normal-looking people. These aren't homeless people. They don't live under a bridge. They don't fit the stereotype of a drug addict. So it's a really powerful opportunity. But today I want to talk for you just for a moment about compassionate care. One of the things that we do during the year of compassionate care is we have a panel discussion. We bring in patients to actually talk about this, and I have to give credit to where it's due. One of my colleagues who taught in the nursing school had, in a parallel course to this one, actually had this idea before me, and we stole it. So, and so we had a panel. We've had a panel discussion on compassionate care, and we have patients in other parts of the curriculum as well, but this one in particular. Hey, we ask the questions you would think to ask, right? What works well? What doesn't work well, right? What types of communication are helpful? What's not helpful? And what can be done to improve healthcare delivery? And we had, for this particular panel I want to talk about, we had an interesting combination of individuals. Sherry is a recurrent melanoma survivor. What you don't know about her maybe is that she's a mom and a grandmom, and she's also a hospital administrator, and she's very familiar with the healthcare process. Her husband's a nurse practitioner, and so they're very well-trained medical people, but it's interesting to hear their story. A friend of mine who happens to be my realtor is a 36-year-old, now he's 46 years old, but at the time was 36-year-old with a heart attack. And as he's told the story in the years since then, you really get the feeling of where that took him and what that did with him. I happen to be on the board of a group called Fight DMD, and they were here, so full disclosure, I'm a board member and scientific advisor. And Terry Marlin was here actually back in the fall to present about Fight DMD and the foundation, and he came and presented about their journey, he and his wife Sonia, and their journey with their board. Then this last one, we had a survivor of anaphylactic reaction to anesthesia. Interestingly, this happened to be the dean of our college of pharmacy, and he told us about how he died on the operating table of Vanderbilt University and had to be revived a couple times. It was very interesting to get these together. I tried to get a screenshot. We had it recorded on a recording system, but I couldn't get a good screenshot. So I put Jonah and Emery, who that's a better picture than I could have gotten anyway. So Jonah and Emery are the sons of Terry and Sonia Marlin, fantastic boys that are challenged with a very serious condition. And you know what came out of this, in my mind, was several really important points. And these are not things that are not already taught in a lot of places, but they're things we have to be reminded of very often. Just the idea of consideration. Sherry told the story as a nurse and a healthcare professional, how the doctor came in and was very matter-of-fact about her diagnosis and about her prognosis and just laid it all out there, and boom, there it's done. And they were reeling from the news and the shock of it all. And she said, I know he understood what we know about healthcare and what we understood, but at the same time, he could have given us a moment to process all this. It was just very matter-of-fact. It was like you're telling somebody, well, my dog got sick, or, it's raining outside, or just something just, okay, well, you got recurrent melanoma. It's spread to this. You're going to have to be treated with that. It's going to take this long. You have this % chance of survival. It's all very mechanical, and she just brought that point to the forefront. Terry pointed out that one of the most helpful things as a father with boys and all of the things that they're interacting with the healthcare professionals, trying to figure out how to care for these boys, one of the most helpful things for them as parents, they were able to meet with physicians, somebody that was there, that was available, that could keep them occupied and interact with them and play with them or whatever. Just somebody that was there to take care of the boys for just a few minutes. Just that consideration of having someone available. And then, the importance of listening. We were kind of the story. His boys now are fully in wheelchairs. They can't walk around on their own. Remember, he was telling us about one of the interactions where, as boys were getting to where they're both in wheelchairs, somebody who was trying to basically a therapist that was trying to say, well, let's figure out how we can get these boys to walk again. I don't understand what they have. You're not listening to the situation. They're not going to walk again. Unless there's some miracle of cure that comes about that allows them to produce this protein that they're not producing properly. It took several minutes of them talking to the therapist, say, no, that's not what we need. We need information about this other area and this other problem. And so, consideration is a big piece of it, and really important. Communication is also really critical. One of the things that's very easy to do is to tell all the stories about all the people that you know that have had that same condition, and all the bad stories, and all the stories you're like, well, I know so and so, and they have this. And so just about being appropriate in your communications and careful in what you say. Be careful of what you say and how you say it. Right? Those things are really, really critical to the patients. And then try to put yourself in the position of the family and the patient. What their needs are as you communicate with them. What would you want to hear? Core of all this for us was compassion, right? Because out of this should flow the compassion that says, I want to take care of you just as I would want someone to take care of me. I want to be able to take care of you. That, of course, for us flows out of our perspective of faith. But it certainly is a really, really critical piece. Patients and families can tell whether you care for them. Just the other day, our dean was telling a story to our students about how he'd gone in to get, he's actually telling our students about going in for an injection therapy. And basically he had a care provider that he'd never met before came in and tried to treat him like they're his best friend. Tried to act like they knew him for so long and they knew exactly what was going on. When there was some confusion about they didn't know who he was or why he was there or what he was being treated for. He's like, don't come in and treat me like this if you don't know who I am. And you're going to treat me like your best friend. And so we have to be really careful about communication. We want to show compassion, but do it in a way that recognizes who you are, who they are, and try to meet somewhere in that context. And the critical thing we always go over with our students in this course, and we say this over and over, is just a reminder that you're meeting students and you're meeting patients in their most critical time of need. Typically not a good day when they're seeing you, right? It's a bad day. This a challenging day. I see this a lot. My sister is going through this with her husband. They have a 2-year-old daughter. My niece Lila is now a cancer patient as of the last. Just to see what they go through on a day-to-day basis, week in and week out. Now it's been a couple months of all the different challenges that they experience and the need for compassion, need for people to reach out. And I appreciate the discussion of support groups because I could see that being a great need for my sister and her family. So with that, there's a lot more that could be said, but I think this as a model is something we need to be doing more and more in healthcare profession training is how do we help students understand their patients, who they're interacting with. Quit seeing them as a series of lab values and numbers and diagnoses and understanding them as dads and brothers and sisters and children and grandchildren, etc. So with that, I thank you for allowing me to be here today. That's our drive-through food clinic. Dr. Campbell is my co-coordinator on this course. My